Hey friends! Are you ready? 3, 2, 1, welcome back to my channel.
Classification of operative dental instruments. Instruments are broadly classified as 1. Hand instruments. These are manually used instruments. 2. Rotary instruments. These are engine-driven instruments. Classification of operative dental instruments. I. Sturtevant's classification. A. Cutting instruments. I. Excavators, ordinary hatchets, hoes, angle formers, spoons. 2. Chisels, straight chisel, curved chisel, fine-angle chisel, enamel hatchet, gingival marginal trimmer. 3. Others, knives, files, scalers, carvers. B. Non-cutting instruments, amalgam condensers, mirrors, explorers, probes. 2. G.V. Black's classification. This classification is based on the use of the instrument. 1. Cutting instruments. A. Hand, chisels, excavators, hatchets, hoes. B. Rotary, burrs, stones, discs. 2. Condensing instruments, pluggers, hand, mechanical. 3. Plastic instruments, spatulas, cement carriers, carvers, plastic filling instruments, burnishers. 4. Finishing and polishing instruments. A. Hand, orange wood sticks, polishing points, finishing strips. B. Rotary, finishing brushes, mounted stones, rubber cups. 5. Isolation instruments, rubber dam kit, frame, clamps, sheet, forceps, and punch. Saliva ejector, cotton roll holder, evacuator tips and equipment. 6. Miscellaneous instruments, mouth mirror, explorers, probe, pliers, scissors, others. 2. G.V. Black's nomenclature according to G.V. Black. This classification is based on the use of the instrument, purpose or function of the instrument, for example, excavator. 2. Suborder, position or manner of use of the instrument, for example, pull and push. 3. Class, form of the working end, for example, chisel and hatchet. 4. Subclass, shape of the shank, for example, mono-angle and bin-angle. Parts of hand instruments, handle, shaft, shank, blade with cutting edge or nib with face, handle/shaft, length 5.5 inches, diameter 5.5 mm, available in various sizes and shapes, small, medium, and large diameter, hexagonal or octagonal, smooth, serrated, or knurled. Knurled to facilitate control and to increase the friction for hand gripping. Instrument formula incorporated on it. Manufacturing kit number incorporated on it. Handle is either continuous with shank or separable. Shank connects the handle to the blade or nib. Smooth, round, tapered, and contrangled. Have one or more bends to avoid the instrument from having tendency to twist in use where force is applied. G.V. Black classified instruments depending on the number of angles in the shank as mon-angle, bin-angle, triple-angle, quaternary angle, contra-angle, and balance. The term contra-angle refers to a shank in which 2 or more angles are necessary to bring the working end into near alignment with, within 2-3 mm the axis of the handle. Advantages: prevent rotation, modified access, greater stability and balance, ease of control. Blade. Functional end of the instrument that bears the cutting edge. It is connected to the handle by the shank. For non-cutting instruments, the part corresponding to the blade is termed nib. Working surface, or the end of the nib, is known as the face. Cutting edge. Beveled, single beveled, bibeveled, triple beveled, 1 primary and 2 secondary bevels. Circumferentially beveled, regular bevel, distal to shaft, reverse bevel, mesial to shaft, for example, bin-angle chisel. Instrument formula given by G.V. Black. 3-unit instrument formula. Cutting edge of the instrument is at a right angle to the blade. First unit, width of the blade in tenths of a millimeter. Second unit, length of the blade in millimeter. Third unit, angle the blade forms with the axis of the handle in centigrade. 4-unit instrument formula. Cutting edge of the instrument is at an angle other than a right angle to the blade. First unit, width of the blade in tenths of a millimeter. Second unit, angle the cutting edge forms with the axis of the handle in centigrade. Third unit, length of the blade in millimeter. Fourth unit, angle the blade forms with the axis of the handle in centigrade. Example: gingival marginal trimmer and angle former. Types of hand cutting instruments: chisels, Cutting edge of the instrument is at a right angle to the axis of the instrument. Used for planing or cleaving enamel. 1. Straight chisel, no bend in shank. Single beveled / triple beveled. Minimal accessibility, used with push stroke or lateral scraping action. 2. Mono-angle chisel. Blade is shorter as compared to straight chisel, single angle in the shank to enhance the convenience form, used with push stroke or lateral scraping action. Hoe. Difference between mono-angle chisel and hoe. If the angle of the blade is less than 12.5 centigrade, it is mono-angle chisel, and if it is more than 12.5 centigrade, it is hoe. Used with pull stroke. Use to define line and point angles. Class 3 and V preparations for direct filling gold restorations. 3. Bine-angle chisel, 2 angles in the shank, used to cleave or split undermined enamel. Reverse bevel instrument. 4. Triple-angle chisel, used to flatten the pulpal floor. Hatchet. Cutting edge of the instrument is parallel to the axis of the instrument. Cutting edge of the instrument is at right angle to the axis of blade. Mono-angled. Length of blade is very small. Bibeveled. Single-ended. Used with push stroke. Use. Preparing retentive areas on anterior teeth. Sharpening internal line angles in DFG restorations. Enamel hatchet. Cutting edge of the instrument is parallel to the axis of the instrument. Cutting edge of the instrument is at right angle to the axis of blade. Bine-angle hatchet. Mono-beveled. Single plane instrument. Paired instrument bevel on right side instrument bevel on left side instrument. Used with push stroke, planing or direct cutting motion as well as lateral cutting motion. Used for smoothening buccal and lingual walls of proximal box. Used for breaking enamel of proximal box. Used for smoothening gingival seat, lateral scraping motion. Gingival marginal trimmer. Cutting edge of the instrument is parallel to the axis of the instrument. Cutting edge of the instrument is at an angle other than a right angle to the blade. Modified hatchet. Bine-angle instrument, mono-beveled double-plane instrument, better lateral scraping efficiency, scooping effect. Mesial pair, right and left. 2 pairs, distal pair, right and left. 4-unit instrument formula, mesial pair, 10, 80, 6, 8, 80. Distal pair, 10, 95, 6, 8, 95. Used to give gingival cavosurface bevel. Angle former. The instruments are made by grinding the bevel at an angle of 80 degrees with the shaft, thus forming an acute angle with the long axis of the blade. This creates a pointed and a linear cutting edge. 4-unit instrument formula, paired instrument right and left, ring on the shank, right side -3 cutting edges. Blade is beveled on the sides as well as the end. Use to exaggerate line and point angles in DFG restorations to establish the retention form. Wettelstat chisel, shank and blade are curved, beveled on one side of blade only. If bevel is on the side towards the curvature of the shank, mesially beveled, away from the curvature of the shank, distally beveled, used for cleaving undermined enamel and for shaping walls. Single instrument with 3 cutting motion, vertical, right and left. Off-angle hatchet, instruments in which blade is rotated by 45 degrees from the plane of the long axis of the instrument. Used to create and shape specific angulations for cavity walls, especially in areas of difficult access. Triangular chisel. Blade is triangular in shape with the base away from the shaft, has a terminal cutting edge like straight chisel. Spoon excavator, modified hatchet, double-ended instrument, bine-angle, triple-angle instrument, paired, right and left, double-plane instrument, circumferentially beveled, cutting edge either circular, discoid, or claw-like, cleoid. Use spooning or scooping of softened carious material, carving amalgam or direct wax patterns. Other instruments, knives, finishing knives, amalgam knives, or gold knives. Used for trimming excess restorative material on the gingival, facial, or lingual margins of a proximal restoration or trimming and contouring the surface of Class 5 restorations. Files. Used for smoothing of overhanging restorations, amalgam and gold. Non-cutting instruments, diagnostic instruments.
Mouth mirror is an instrument having a mirror head top and a detachable handle, also called as odontoscope. Types: A. Front surface is one where the reflecting surface is on the top of the glass piece, gives better visibility. Absence of intervening glass, no double image. Mercury coating on top is likely to be lost due to scratching. B. Rear surface, regular. Reflecting surface is on the back surface of the mirror lens. Surface is less easily scratched. Produces a double or ghost image. C. Magnifying mirror, concave. Reflecting surface is on the front surface of the mirror lens. Produces magnified but slightly distorted image. Concave surface mirror magnifies the image, requiring the clinician to learn to accommodate movement. Concave mirror rarely used except for seeing enlarged internal details of the cavity. The instrument movements are smaller than the clinician visual perception. For endodontic surgeries. D. Disposable mirror. Made of plastic. Uses. Indirect illumination. Mouth mirror could be held at an angle to reflect the light onto the working area. Retraction. Mirror head used to retract the patient's lip or cheek or tongue so that the clinician is able to view tooth surfaces. Protects from injury. Indirect vision. Guard. Trans-illumination. Only maxillary and mandibular anterior teeth can be trans-illuminated. 2. Probe. Sharp-pointed hand instrument used to explore teeth and restoration surfaces in order to detect caries, overhanging edges, and other defects. May be single-ended or double-ended. Uses. Exploring lesion. For detecting and assessing carious lesion in the tooth. Detecting demineralized dentin. Releasing debris from the tooth. Removing slight excess fill-up around cavo surface margins. Identifying hypersensitive areas in the tooth. Assessing marginal fit of the restoration types. Straight. Interproximal probe. No2 cowhorn, arch explorer. No17 back action, No23 shepherd's hook. Orban, type explorer.
3. Periodontal probe. Detect and measure the depth of periodontal pockets. In operative dentistry, used to determine the dimensions of instruments and of various features of preparations or restorations. 4. Forceps, tweezers/cotton forceps, hemostats, articulating paper forceps, tweezers, hand instrument with two narrow and pointed straight or curved beaks used to grasp small objects. Consist of 2 long arms, locking device, 2 long arms joined at one end. Uses, useful in carrying things to and from mouth. Carrying cotton rolls, cotton pledges, sponge pellets to and around the cavity. Carrying saliva-soaked cotton rolls from the oral cavity to the waste disposal unit. Locking tweezer. May have a locking device to maintain the beaks in a closed position until released. This avoids the unnecessary anxiety of the operator at the possibility of slippage whatever is carried by the tweezer. Restoring instruments. Mixing instruments. Cement spatula, agate spatula, spatulas. Flat and wide nibs with blunt edges. Shank straight. Different sizes and different degree of stiffness in their nibs to suit their various uses. Made of stainless steel, plastic. Doubles-ended instrument, blunt end, for manipulating impression materials. Sharp end, for mixing cements. Used for manual mixing of cements supplied as powder and liquid. 2. Plastic carrying/filling instruments. It is an instrument used for carrying the mixed base cements, which are in soft, plastic stage, or the restorative cement from a cement spatula to the cavity. Usually one end is flat and other end is cylindrical. Flat end is used for carrying the cement. Cylindrical end is used for manipulating and positioning the cement. Made of stainless steel plastic. Also can be plated with Teflon to minimize material adhesion. 3. Packing instrument. Amalgam carrier. Amalgam carrier is a stainless steel instrument used for carrying mixed amalgam to the cavity. Use. Hollow tip of an amalgam carrier is inserted into the mixed amalgam to pack the carrier with amalgam. It is then carried into the cavity and plunger is pressed injecting cylindrical pellets of amalgam. 4. Condensing instruments. To pack material into prepared cavity. Types. A. Amalgam condenser. Hand mechanical, vibratory and impact type B. Gold condenser, hand mechanical. Hand condenser are double-ended instruments with the nibs, condensing tips, coming in different size and shapes. Nibs may be 1. Of different shapes, round elliptical diamond, tria, angular parallelogram, rectangular 1, sizes vary considerably, large round condenser, small round condenser 3, depending on working end, condenser face. Serrated, for spherical amalgam, non-serrated, smooth, for admixed amalgam, different types of amalgam condensers. 5. Burnishing instruments. Hand instrument with rounded edges used to polish or burnish the surface of metallic restorations by rubbing. Burnishing is the process of rubbing usually performed to make a surface shiny or lustrous. Double-ended. Nibs are spherical, ball-shaped, egg-shaped, apple-shaped, beaver tail-shaped, conical, hourglass, fishtail, bullet-shaped, etc. Amalgam burnishers, small ball burnisher, beaver tail or egg burnisher, anatomic burnisher. Other uses: shape metal matrix bands so that they impart more desirable contours to restorations. To bend cast gold near the margins to narrow the gap between the gold and the tooth, beaver tail. 6. Carving instruments. Hand instrument with a blade or nib used to contour the surface of filling material in their plastic state, waxes, models, and patterns. For example, Hollenbach carver, knife-edged elongated bibeveled, diamond, Fromm's, carver bibeveled cutting-edge wards, C. carver discoid, cleoid interproximal carvers.